Hello there, I'm Kate Miles from the Mind Body Reset, and I'm here today to talk to you about generalised anxiety disorder. Now, we all worry at times, even possibly most of the time, but generalised anxiety disorder, or GAD, is characterised by persistent and excessive multiple worries. Adults and teenagers with GAD anticipate disaster and become overly concerned about money, health, family, work, etc., making it very difficult for sufferers to control their worries, so they can be relied upon to expect the worst. GAD is only diagnosed if it becomes difficult to control worries more days than not, for a period of 6 or more months, whilst also reporting 3 or more of the following symptoms: feeling nervous, irritable, on edge, having a sense of impending doom, danger, panic, an increased heart rate or hyperventilation, excessive sweating or trembling, and feeling weak or exhausted, having difficulty concentrating or trouble sleeping, having digestive symptoms. Now, the cause of GAD is unknown, but it's considered likely that biological factors, family issues, and traumatic events are relevant. GAD sufferers are generally particularly sensitive to uncertainty, so during times of crises, they attempt to control situations or elements in the periphery in an attempt to feel back in control. They also believe that worrying may prevent bad things from happening, when actually evidence suggests that thinking negatively can alter our behaviour and feelings unfavourably, meaning we are what we think. Now, it's common for GAD to be associated with other anxiety disorders, depression and substance abuse, which may be a progression or coping mechanism. However, there are plenty of treatment options available, such as talking therapy, medication and stress management. Now, any talking therapy can be of help, but those that target thoughts, behaviours and physical symptoms, such as sentimentology, a blend of guided visualisation and lucid dreaming, can be particularly beneficial, as it can change the way you think and react, and non-traumatically addresses your past without the need to overtalk. Medication like selective serotonin reuptake inhibitors are preferable, as they're considered relatively safe and cause fewer side effects than other options, but they're not a magic bullet. If your symptoms are severe though, medication may well be necessary, especially at first, but it's also advisable to undergo talking therapy, as this increases your chances of becoming medication free in the future. Stress management may include complementary therapies, exercise, self-help techniques and lifestyle changes. Why not consider remote osteoduce energy healing, which can potentially improve skull, spine and pelvic movement, and is thought to have a calming effect on the nervous system. Exercise can be very beneficial as long as it's enjoyable. Gentler exercise like walking in nature, yoga, tai chi, kinergy can all help move your body and relax your mind. Owning a pet can also help. Dogs are great as they get you outside, whatever the weather, but any pet you can spend time with can be very calming, as long as you can care for them properly. Regular relaxation can reduce your heart rate and anxiety levels, and doing more of what you enjoy is a great addition, like reading, crafts or taking a bath. Stress management techniques like breathing exercises, visualizations, anchoring and EFT tapping can all help reduce your background anxiety levels, manage stressful episodes and diffuse difficult memories. Lifestyle changes that promote self-care can also help you reduce your symptoms by making sure you give your body the rest and nutrition it needs. We wouldn't deprive our children or animals of sleep, water, proper food, adequate rest, fresh air, daylight or exercise, but we so often expect ourselves to thrive without these essentials. It is also worth remembering we cannot be healthy if we're not happy. So focusing on present and past elements that are affecting your happiness is crucial when it comes to turning around or toning down your generalised anxiety disorder. No matter how difficult life seems, remember there is always a way to improve it, even if only just a little. So start with one palatable change, see how you feel as a consequence, then take the next approachable small step. And once you are starting to move forwards, you will gain momentum and find it easier to make more significant changes going forwards. Please DM me to ask a question, book a health boost audit or request a discovery call to chat about how the Mind Body Reset could help you. Thank you for watching. Bye bye.